Peptides are a big topic today on social media. Peptides are short chains of amino acids. They vary from anywhere as few as 3 to 6 or 8 amino acids in a particular sequence. There's various types of peptides. For example, there are some peptides that stimulate growth hormone. These peptides are very useful because, unlike growth hormone injections, they tend to produce far less degree of side effects, and also they work within your own body. The growth hormone releasing peptides work by actually bypassing the usual inhibitory factor that blocks growth hormone. It's called somatostatin, and it basically allows you to kick out your own growth hormone. So somebody who's considering using growth hormone, especially if you're deficient in growth hormone, would probably be better off to try a growth hormone secretagogue, as they're called, which basically is a peptide. And there are other peptides I've talked about in previous videos. BPC-157, for example, which is a healing peptide. BP stands for body protection factor, and it's a lot of people rave about it. It's an injection. It's often used to treat let's say, joint injuries, muscle injuries, and a lot of people, I talked about that in a previous video. You might do a search for my channel to find that out. But today I want to talk about another peptide I came across. I was looking on YouTube. I came across a video extolling the virtues of something called PT-141. When I saw the name PT-141, it vaguely rang a bell. I knew I came across it somewhere. And then when I started to read a little bit about it, by the way, this video was talking about how it would give you these tremendous penile erections that were like hard as a rock, like you could break through a door with them. You know, I mean, crazy claims about this stuff. I mean, it made the usual treatment for ED or erectile dysfunction, such as Viagra and Cialis. They're called PDE5 inhibitors. I'm not going to get into the biology behind that, but I also talk about that in my applied metabolics about drugs like Viagra. But that's not the subject of this video. PT-141, like I say, I knew I had seen it somewhere, and I thought about it. A couple of years ago, I wrote an article for my applied metabolics publication called The Barbie Drug. It was about certain drugs and peptides that were being used to enhance physical appearance. And one of these that I discussed was called melanotan 2. Melanotan 2 was a peptide that actually stimulated tanning. In other words, it gave you a darker hue to your skin. You didn't even have to go in the sun with it. I suggested in the article that it might be a good idea for people to use this drug who are worried about sun exposure because of the aging effects, for example, of ultraviolet rays. 80% of facial aging, 80% is due to the exposure to the sun's UV rays. And of course, we have the issue of skin cancer, particularly melanoma, which is the most dangerous type of skin cancer. It's 50% mortality rate. Once that type of cancer spreads, usually the person dies, so they have to catch it early, melanoma. I'm not going to get into the signs of melanoma. Again, that's a different video. I want to talk about PT-141. And right off the bat, one of the really interesting things about PT-141 is that it's a drug for both men and women. The PT-41 is also called bremelanotide. I want to make sure I pronounce this. I'm always criticized for my pronunciations. Bremelanotide. It's also, of course, PT-141. It's a peptide, and it lasts for 24 to 72 hours, believe it or not. And it was actually marketed originally to treat female sexual dysfunction in younger women. Now, they came out with another drug a couple of years ago. Let me see if I could get the name of that drug. Hold on. They came out with this drug a couple of years ago. what's it called? I'm trying to find it here. Hold on a second. Let me see if I could find the name of the drug. Well, it's not important. Anyway, they came out with a drug a couple of years ago for postmenopausal women to also increase sexual libido or sex drive. Unfortunately, that drug had some problems with blood pressure, and it wasn't. When doctors realized it can cause cardiovascular problems, kind of fell into the the limbo area of a lot of drugs that aren't frequently prescribed. Now, PT-141 also is not popularly prescribed. In other words, if you have erectile dysfunction and you consult, let's say, a urologist, he'll probably put you on either Viagra or sildenafil. That sildenafil is Viagra, or Cialis. Now, these things work by, like I said, these drugs work by inhibiting what they call PDE5, and by doing so, it increases the local production of something called cyclic GMP in the penile tissues. Now, cyclic PNG in turn increases nitric oxide production locally in the spongy tissues of the penis, which results in an erection if everything goes right. And that's how Viagra and Cialis works. Like I say, the actual generic name for Cialis is tadalafil. Anyway, I'm not going to go into the different differences between them. However, the problem with drugs like Viagra and Cialis is they can produce various side effects such as stomach upset, headaches, because remember, it dilates blood vessels, and a lot of headaches are caused by dilation of blood vessels in the superficial blood vessels. It can cause flushing, and it can cause the worst side effect of taking drugs like Cialis and Viagra is something called priapism, which is an erection lasting for more than 4 hours. Now, a lot of men will say, hey, that sounds pretty good to me, but the problem is, these long-lasting erections related to priapism can cause permanent damage to the penis, so you have to get to the hospital if you have priapism, and have the doctors literally, drain out the blood, because before damage to the penis ensues, where you actually have permanent damage. If you're taking drugs called nitrates, which they give to people with cardiovascular disease, particularly a problem called angina pectoris, which is caused by a narrowing of the coronary arteries, where the heart, you don't get a good blood circulation in the heart. So what happens is the heart muscle, it undergoes a certain amount of pain called angina pectoris, and doctors again prescribe nitrate drugs. However, nitrate drugs interact with the PDE5 inhibitors like Viagra, and it can cause serious heart problems. And not only that, but the PDE5 drugs like Viagra, Sildenafil, Staxin, and Evanafil, these are a couple other names, they're only effective in 40 to 80% of patients. In other words, not all men who use these drugs get the desired effect, which is an increased erection. Sildenafil and Sildenafil have similar half-lives of 4 hours. That means they start to break down within 4 hours. So the Cialis is a little bit superior drug because it tends to work faster than Viagra, and it also lasts longer. It lasts 17.5 hours, whereas the PDE5 inhibitor Evanafil has the shortest, only lasts 3 hours. So there's the drug called Sildenafil. You have to be careful. Certain heart patients have a problem called prolonged QT interval, and if they take this Sildenafil stuff, they can have heart problems. Now, the name of the drug I was trying to remember earlier, that they called female Viagra, under the trade name Adyi, ADDYI. The generic name was Flipanserin. It was dubbed the female Viagra, and it was approved in 2015 for the treatment of hypoactive sexual desire in younger women, and was classified as a multifunctional serotonin antagonist. In other words, it interferes with a brain neurotransmitter called serotonin. But now, the reason why it's generally not often prescribed is because it has what they call a black box warning, meaning it can cause some serious side effects, including fainting and low blood pressure, and it should never be combined with alcohol. So now that enters the picture PD-141, this peptide. Now, you have to understand the PDE5 inhibitors like Viagra and Cialis, they do not increase sex drive or libido. All they do is increase the ability to obtain an erection. What actually controls sex drive in both sexes is testosterone. Testosterone is the hormone of libido, and one of the reasons why testosterone increases sex drive is because it interacts with a brain neurotransmitter called dopamine. When dopamine is high, so is your sex drive. Dopamine, it's also called the pleasure neurotransmitter because it's involved in drug addiction, food addiction, and also mental drive to do things. That's dopamine. So anyway, PT-105, it's like I say, what happened is, getting back to those Barbie drugs I was talking about earlier, melanotan-2 was developed, and it stimulates melanin production, which is the same thing that's stimulated by exposure to the sun. So theoretically, melanotan-2 can give you a tan without even having to go in the sun. But as I pointed out in my Barbie article, it works better if you do expose yourself to, let's say, a minimal amount of ultraviolet rays. And the advantage of melanotan-2 is you don't have to sit in the sun for hours. You get a tan much faster with melanotan-2. But melanotan-2, unfortunately, also has a serious possible, it's not a common side effect, but some studies have shown that it apparently has a relationship to stimulating the skin cancer, the melanoma, the most, so that anyway. Here's the funny part of the story. One of the researchers, when they were investigating melanotan-2, this researcher, I don't know how this happened, don't get me wrong. A lot of times in science you have these serendipity discoveries like artificial sweeteners. I mean, the artificial sweetener sucralose was discovered, or it might have been aspartame. I get them confused. It was discovered accidentally when a researcher tasted it and noticed a sweet taste. In other words, they were searching for a blood pressure medication, and he tasted this stuff, and it tasted so sweet, they wound up selling it as an artificial sweetener. That happens in science, and that's what happened with PT-141. The scientists were investigating melanotan-2, and somehow this researcher, melanotan-2 was an injection. He accidentally pricked himself with the needle, and he wound up getting a erection for 4 hours. So the researchers went back to the drawing board, and they realized that there was something in melanotan, or something about melanotan-2, that caused erections, and they isolated it, and it turned out to be this stuff, PT-141, it's hard to pronounce, bremelanotide. Again, it's a synthetic central melanocortin receptor agonist. In other words, it works by interacting with what they call melanocortin receptors in the brain, and it increases something called alpha melanocyte stimulating hormone, and that is what causes the tan, believe it or not, that stuff. It's like I say, it's a metabolite of melanotan-2, and as I said, the researchers, when they started to experiment with it, they noticed an increase in sexual activity and an increase in libido. But the side effects associated with melanotan-2 itself include nausea, vomiting, yawning, and a delayed onset of erection of 2 hours. So the researchers looked at the melanotan-2 structure, and they tried to isolate this, whatever is in there that can cause these erections and increase in sex drive. And in 2000, they isolated or synthesized PT-141. Now, as I said, the PDE5 drugs like Viagra and Cialis, they work by increasing nitric oxide and vascular function. Like I say, they dilate the blood vessels in the penis. But PT-141 doesn't do that. It works on a different, let's say, pathway. It works on the central nervous system, and because of that, it not only does it increase erections, but it increases sexual desire in both men and women. There's 5 melanocortin receptors, numbers 1 to 5, and the studies show that PT-141 has the highest affinity for the melanocortin receptor 4. And in the hypothalamus area of the brain, alpha MSH, or alpha melanocyte stimulating hormone, suppresses appetite. So this can actually cause appetite suppression. It also contributes to improved sexual function by increasing penile erection and sexual desire and arousal in both men and women. So this particular stuff, PT-141, this peptide, actually not only increases erections in men, it also increases sexual desire in women, and it has the bonus of decreasing your appetite, so it helps you diet and lose weight. That sounds pretty good, doesn't it? Now, what does the research shows? Let me see here. In laboratory studies, administration of melanotantal PT-141 significantly promoted behavior in female rats, sexual behavior in female rats, and appears to be the first true aphrodisiac. That's a pretty broad claim. Studies using animal models have demonstrated that procopulatory behaviors, increased sex in other words, in female rats analogous to sexual arousal are evoked, and preliminary clinical data also just suggest a role in promoting sexual desire and arousal in women. This is why when PT-141 first came out, it wasn't packaged, or still isn't actually packaged, as a erectile drug for men. It's actually was packaged as a drug or a substance to increase sexual arousal in women. In other words, another use for it is to increase erections in men, but that's not what it's primarily used for. One thing that you should know is that you should never inject. Now, I should also tell you, before I forget, PT-141 comes in 2 forms. One of it is a subcutaneous injection. We inject it right there in the penis. And the other one is a nasal spray. Of course, the nasal spray is a lot more convenient, and theoretically, you could absorb peptides through the nasal mucosa because they bypass the digestive system and aren't broken down. Now, this is a controversial subject because some clinics which give out PT-141 claim that the injected versions are much more efficient than the nasal forms of PT-141. So whether that's true or not, I really couldn't say. But I know that it is possible to absorb PT-141 through a nasal route. The initial studies of PT-141 using the nasal route resulted in hypertension, high blood pressure. And so the clinical trials that were testing intranasal 141, the PT-141, were discontinued in 2008 because of that. Now, the reason why would it cause hypertension? Because when you inhale something through the nasal route, through the nasal mucosa, it almost goes directly into the brain. I mean, it works very, very fast, within seconds. And for some reason, it might kick off a little bit of higher blood pressure. So because of that, they were afraid, and the company that was sponsoring the research stopped the research. It was called Paladin Incorporated. So what they did is they reformulated it as a sub-Q injection using an auto injector. They completed a couple of studies, and they came out with a trade name called Rekynda, Rekynda. I think it's also sold online. It's sold in various clinics, sexual treatment clinics. Now, what's the possible side effects? With injections, it's redness and pain at the site of the injection. Sometimes gastrointestinal distress, including nausea. You could take an antihistamine drug to prevent that. Flushing and heading. If you use it before sleep, it can interfere with sleep. It can also cause a rapid heartbeat, also called tachycardia. It's recommended to be used only twice a week to prevent tachycardia from beginning. If you experience priapism or prolonged erections or an erection lasting longer than 4 hours, you're supposed to discontinue using this stuff. You should never use it with any other type of erectile drug like Viagra or Cialis. And let me see, what else can I say about this stuff? There's another type of injection that I'll mention that it's even more commonly available. It's called Trimix. Trimix is an interesting compound because Trimix is literally the secret of male porn actors. Male porn actors have to get an erection fast, and they have to keep it to film those scenes. And what they do is they inject right before they do a scene. They inject Trimix. And what is Trimix? Trimix is a mixture of 3 ingredients: alprostadil, which is a prostaglandin, which dilates blood vessels; phentolamine, which is a drug normally used to treat high blood pressure, also dilates blood vessels; and papaverine, which is still another drug that dilates blood vessels. And these ingredients work by relaxing the smooth muscle in the penis, opening the blood vessels. In other words, Trimix is basically a super injectable form of Viagra or Cialis. So, I think, what else can I tell you about this stuff, PT-141, PT-141, I should say. Let me see if I left anything out. The intranasal doses are 4 to 20 milligrams. Let me see, increased duration of it produced increased duration of rigid erections of 140 minutes compared to 22 minutes in the placebo group. The time of onset of erection ranged from 34 to 63 minutes. That means after taking PT-141, it takes a half hour to an hour to get an erection. What else? Let's see. I think that's about it. There were no episodes of fainting or hypotension, low blood pressure. The only serious adverse event was one patient who reported a prolonged erection that was painless and required no treatment. Gastrointestinal side effects were the primary reasons for discontinuation in the higher dose groups. And let me see. I think that's about it for this thing. So anyway, I did this video because I came across that video on PT-141, where it's making claims that it gave you the hardest erections of any drug known on earth. And like I say, I had a passing familiarity with it. I did a little bit of reading on it, and that's what I presented here. As far as the availability, as I said, there's a lot of erectile dysfunction clinics that give out PT-141. I believe you can also buy it online, and it's the price range I've seen is anywhere from about $43 to up to $250. That's for a 10 milliliter, whatever it is, a vial of it, But, as I said in past videos, my problem with peptides that are sold online is related to the purity and the potency. Because when you buy these peptides online, none of these companies are legitimate pharmaceutical companies, and they don't produce drugs with the same standards that are required for legitimate pharmaceutical companies, such as absolute purity and cleanliness, guaranteed potency. All this stuff doesn't really apply to online peptides. I'm not saying that they're all fake or they all work or none of them work, or that they're that they could be contaminated. I'm not saying that. But there's always the outside possibility, because these online purveyors of peptides are not monitored by the FDA. If enough people get sick, that's when the FDA might step in, but apparently that doesn't happen. I myself, here's an admission, I have many times thought about trying various peptides, including the growth hormone secretagogue, including BPC 157. I never thought about PT-141, and I never considered melanotan 2 because I'm not interested in either one of those things. The reason why I didn't try the peptides is precisely for what I just told you. I don't trust the online sellers. I don't know what they're selling me. I don't know the potency. I'm not going to pay a couple of $100 to have it analyzed. So I just avoid them. That's just my choice. But if you want to try any of this stuff, go ahead, be my guest. I've spoken to a lot of people that have used various peptides, and they swear, they did buy them through online purveyors of these stuff, and they swear that they got good results. A lot of them said BPC 157 helped them heal injuries. I haven't spoke to anyone who took PT-141, but I'm sure there's plenty of people that will attest that it really does work as good or even better than the Viagra and Cialis more common ways of treating erectile dysfunction. But again, you always have to be aware of the placebo effect. In other words, if you believe something's going to work, and in many cases it will, even though it's not actually doing anything, it's your brain that's making the substance work. So I'll leave it at that. If you want more information on nutrition, exercise science, anti-aging research, ergogenic aids, supplement science, which supplements work, which supplements don't work, what else? Women's health and fitness. I cover more topics in applied metabolics than any other digital publication. It's 30 to 45 pages each month, no ads. I'm not involved with any supplement company, so I'm not going to try and push supplements on you. There's a lot of these YouTube video guys that are just shills for supplement companies. They have ulterior motives. They're trying to push supplements at you. You'll never see that in applied metabolics. When I discuss a supplement, I talk about it generically. I don't mention product names because I'm not a shill for supplement companies, so I'm not about to push their products. I give you the 100% truth. And if you want the truth, you should subscribe to Applied Metabolics, www.appliedmetabolics.com. And when you subscribe, send me an email. I'll send you a invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise, and general medicine. I have an email portal on my Applied Metabolics webpage, which is exclusively for current subscribers of Applied Metabolics who are welcome to send me short questions about anything they read in Applied Metabolics or anything that they're curious about related to nutrition, exercise, and I will be happy to answer those short questions in appreciation of their subscription to Applied Metabolics. Obviously, this doesn't apply to people that aren't subscribers. So you have to be a subscriber for that, and you also need to be a subscriber to get on the private Applied Metabolics Facebook page. So that's about it. If you want to have the best fun you'll ever have, go to your local shelter, adopt a dog. I still don't have one, but I'm going to get one soon. There's a couple of reasons why I haven't gotten a dog yet. They're personal reasons. I'm not going to go into it here. But let me put it this way. I don't think it wasn't fair for me to get a dog until, let's say, now. So I'm going to be looking really for a dog as soon as I can. Take care. Thank you for listening. Oh, by the way, one other thing. I post new videos on this channel every Tuesday, so feel free to join. It doesn't cost you a dime. Like I say, if you think these videos are of any value, please pass on the information to other people about the existence of my channel, Jerry Brainham channel. There's no bells and whistles. I don't have any fancy graphics or cute little videos that I show in between of people making funny expressions. I just give you the solid, evidence-based facts, which is far more valuable in my mind than any of these little, quasi-entertainment stuff that they pack in these videos to attract probably simple-minded people who otherwise could not sit through more than 5 minutes without being entertained by cartoons and little people making funny faces. So anyway, that's it. Take care. Bye-bye.